So this is the first question. Which client the nurse should see first in the emergency room? You have 4 EKGs. Who do you think the nurse should see first? You have to identify what each one of them is, and then you can figure out what is the condition. You have to identify this one, that one, that one, and that one. Then use that to answer the question. You have to know what condition each represent. You have to know that sinus Brady is worse than normal sinus, right? Who do you think the first one is? The second one, and third one, and fourth one. If you look at this EKG, you can see like the rhythm is normal. If you count 1, 2, 3, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. So the rhythm is normal. But as soon as you move from here, it's normal, normal rhythm, normal rhythm, normal. But when you get here, there's this guy here. It looks like a ventricular rhythm. He has no atrial effect. These are atrial and ventricle. So this is different. It's abnormal. It just fire abnormally without following the pattern, and then everything pick up again. This is what we call PVC. So this is a PVC. Same thing. You look at this, you say, oh, this is normal. Always check the rhythm first. This guy is not normal. This is normal, normal. The rhythm here and here and here and here are equal. All of a sudden, we have a short rhythm. It did not repeat itself. If it did repeat itself, and then you may have irregular rhythm, but this is the only one. The rhythm pickup and remain constant. There's only one associated with that. And you can see that is because of the atrium contract so fast before over here, before everything started. So this is PAC. So you have a premature arterial contraction, premature ventricular contraction. Then look at this guy. The rhythm is still uniform. Always check the rhythm. From here to here, the distance are the same. I see P wave, but I see a bunch of P waves, right? And then these P waves look like they saw-toothed. I can't distinguish between the T wave. I see like more than 1 or 2 P waves. These are Flutter waves. Then you look at this. This is also rhythm. It's uniform, but you cannot see the P wave and the T wave. When the P wave and the T wave are completely buried, and the rhythm is very fast. There's only 2 boxes between that. That means 300 over 2 is 150. So it's a very high rate. So heart rate of 150, you don't see any P wave. The P wave is buried. This is SVT. So you have a Flutter wave, you have a PAC, and you have PVC. Who do you think is a problem? Which one is the most dangerous? It's a Flutter wave. Number 2, what is the next first action for a client with the rhythm in the ICU with myocardial infarction? So this guy had an MI, and you see this. What are you going to do? What is the next first action? First, you got to identify that. So what do you think? What is the next first action? What is the rhythm first? You don't see the trick to identify is you don't see any atrial rhythm. These are all ventricular rhythm. So it's a ventricular problem. And it's not uniform, it's chaotic. Therefore, it's a type of ventricular rhythm that is chaotic. What does that mean? If you identify it, then you know what to do. You do a CPR, defibrillation, synchronize, cardioversion, or check the pulse. V-Fib, when you see somebody who has a V-Fib, their heart is not pumping. They're completely dead. So V-Fib, you're dead. Therefore, if they're dead, what are you going to do? So this patient needs immediate defibrillation. CPR is not going to help with that because that patient is dead. So we could see the immediate and defibrillation. Synchronized cardioversion is used for tachyarrhythmia. Checking pulse in this patient, the patient is dead. It's not going to help you. So that's the right answer. And I give you some short explanation of it. And let's enter a client room when the rhythm shown below was observed on the cardiac monitor. So he went to the client room because he saw this rhythm and find the client reading in bed. He's reading a book. What is the next first action? Easy way is always check if it's what? Uniform. This is regular. The length are the same. Then you got to check how many length. The rate 1, 2, 3, 4, 5, 6, 7. So 300 over 7. That's really low, right? Less than 50. Heart rate is really, really low, right? So this is bradycardia. But what is the problem? It's bradycardia. The patient is in bed and he's reading. He's reading the book. What do you want to do? The key with bradycardia is you have to check if they have symptoms. That's all. Does this patient have symptoms? If they have symptoms, you treat them, right? So monitor, administer prescribed atropine, put a transcutaneous spacer in, ask the client how or she is doing, and give them metoprolol. So what will be your answer? Patient is in bed and is reading. So what would you want to do? You're going to give the patient atropine. Are you going to put a transcutaneous spacer on the patient, or ask the client how he or she is doing, or give them metoprolol? So checking for symptoms is asking them how they doing. You give them atropine if they are symptomatic. If atropine does not work, you give them transcutaneous spacer. Beta blocker is going to make them more bradycardia. So that's the wrong answer. And let's observe the rhythm below on the client in the intensive care unit. What is the next priority action? This is what you see. Identify it first and figure out what you should do. So what is the client? What rhythm is this? As I've told you multiple times, always figure out the rhythm first. You can see this, that. This is not irregular. You can see different length. There is different length. It's not only one. This is not a PVC because I can see another one here. This is the same as that. So it's not a PAC, right? The rhythm is irregular and there is no P wave. I don't see any P wave yet. You see a bunch of knots here. So it's not a P wave. So what do you want? How would you diagnose this? And what is the problem? After you diagnose it, what is your priority function? So this looks like it's atrial fibrillation. And it said the patient next observe this. So what is your priority action? The key is check if the patient has symptoms. They've not told you anything. So I assume that patient has no symptoms. And number one action for atrial fibrillation is rate control. So control the individual rate. Which of these control people's rate? Echocardiogram, that's not control. NCLEX is what we call concept test. If you master the concept, trust me, nobody can take this from you. If you know that the concept for atrial fibrillation is rate control, and if it's rate control, then I'm picking an answer choice that is rate control. Warfarin does not control your rate. Atropine is going to make this what? The heart rate goes up. It's an anticholinergic, it will go up. So you left with this test-taking strategy. Beta blocker is your answer. So always go with the concept. Okay, guys. concept is the key. If you pick C, once again, atrial fibrillation, the priority function is to control the rate, not to give anticoagulation. So, and this assess a client who has no pulse. Pay attention, no pulse and unresponsive with the rhythm shown below. Actions you did not take. The client assess, and let's assess a client who has no pulse, unresponsive with the rhythm below. After providing high quality CPR for 2 minutes, what would you do? This is the rhythm. This is what you see. What kind of rhythm is this? It looks like it's a flat line. It's asystole. What is the management of asystole? This is not a shockable rhythm. You can't shock it. If you pick a shocking answer, it's wrong. That is the concept. Once again, NCLEX is concept mastering. I show you asystole. I'm telling you, it's not a shockable rhythm. Therefore, test-taking strategy, you're going to eliminate this, you're going to eliminate that, because these are all giving electricity. Then you got to weigh between these two, right? Atropine is for bradycardia. Therefore, you're left with this. This is going to jumpstart the heart. So you see the strategy, how you answer the question. That's the way you should approach it. Okay? That's your right answer. Now, NS is assessing a client in emergency department. The nurse observed the rhythm below on the cardiac monitor. Client has no complaint. What is the nurse's first action? So look at the question and come up with the bars rate. I will show you the rhythm later. But a nurse is assessing a client in emergency department. The nurse observed this rhythm below. Patient has no complaint. That means they have no symptoms. What is the nurse's first action? Look at it carefully. First thing you do is to see if the rhythm is sinus. If it's sinus or regular, yes. Then you find the rate. You see how much is the rate. After you find the rate, if you can see P wave for everything. And then you make a diagnosis, then you figure out what kind of management is allowed for that problem. If you look at it, it's regular from here to here to here to here. So we have a regular rhythm. Then you look at the distance between here to here, there is almost one or two thick lines, this line. So you almost like 150. And you look at it, I see one, this is T wave or P wave. I can't tell. There's no time for the T wave to even relax. There's no time for the T wave to show itself. So we have a bunch of T and then P together. So you have one wave that is mixed with each other. You don't have like two, like sawtooth that we saw. This one is like only one between them. So you don't know which one is T or P. When you see that, you can see that the ventricle is normal. It looks normal. Therefore, it's not a ventricular problem, right? So it's not ventricular. It's above the ventricle. So it's supraventricular and it's tachycardia because it's fast. That's how you can recognize it. It's a fast rhythm, tachycardia. The ventricle is normal, so it's not a ventricle problem. It's an atrial issue, so it's a supra above the ventricle. So this is a SVT. If this is supraventricular tachycardia, then what is your management? You have adenosine, you have diltiazem, you have metropolol, you have atropine. I can tell you atropine is wrong because atropine is going to speed your heart rate up. The guy heart rate is already high. This is all of them. We got to slow you down. Adenosine can slow this down. The thiazide can slow this down. Metoprolol can also slow you down. But what is the right answer? Which one is better? Which one is the first line agent? The first line agent is adenosine. So adenosine is the best choice for any SVT. Okay, guys. So I said this is a SVT, and the first line treatment is adenosine. Beta blocker and calcium channel blocker are also effective, but not the first line. And let's provide care for a client in the emergency department with the breathing below. The client is diaphoretic and a blood pressure of 90/70. Which intervention the nurse should expect? Once again, don't answer the question. Don't even look at the rhythm until you know what you're supposed to do. Patients in the emergency room. The client is what? I'm seeing, why are they giving me diaphoretic? All the cases I've given you, I just give you and I let you find it. And then blood pressure is 90/70. Which intervention the nurse should expect? So this is the blood pressure and it's ready, diaphoretic. So something is not right. And you look at the rhythm, what do you see? So make a diagnosis and then figure out what do you think. What do you think is the diagnosis? And then what do you want to do with the patient? As you can see, this rhythm is not regular, right? It's not a regular rhythm. From here to here, it's not the same as here. We've seen this multiple times. So this is atrial fibrillation. So you have AFib. Now, I've given you the answer by identifying the rhythm for you. So this is AFib. But it's not just AFib. It has this associated with it and this associated with it. Therefore, select or apply. What action should the nurse take? So what action would you think the nurse should take? Administer small dose of prescribed Valium, verbal consent by the healthcare provider, synchronized cardioversion, immediate defibrillation. Select the synchronized mode on the defibrillation, immediate high quality CPR, or this should say defibrillator, basically. So it's a select or apply. AFib with the hypotension and diaphoretic, this should say defibrillator. I will change it, defibrillator. So what is your answer? I see somebody say C, D, F. That's what some of the answer choice is. So what should be your rhythm? You have AFib that is unstable. That's the way you can do it. AFib, unstable AFib. So this is hypertension, diaphoretic is called unstable AFib or symptomatic AFib, unstable. Unstable AFib need cardioversion, immediate cardioversion. So before you can do cardioversion, you need to turn the sync mode on. Before you do cardioversion, after turning the sync mode on, give the patient some sedation. Give them some Valium to relax them. But before you give them Valium, you got to tell them this is what you're going to do, verbal consent. After you finished, you synchronize cardioversion. You don't need defibrillation. You don't need CPR. So this is what you do. First, talk to them. give them Valium, turn the sick mode on, and then shock them. So that's the way it will go. So ABC, each prescribed medication the nurse should recognize as the cause of it. So the nurse perform medication reconciliation, and she find this. What do you think? What do you think? What do you see? Why is adenosine not giving for asthma attack? This is one of the test taking strategy. You can tell when you see questions like that. This is somebody's asking. When you see a question like that on the test, they've given you the answer. Why is adenosine not given to patient with asthma attack? What is asthma patient? What is their problem? Bronchospasm. That's what caused the problem. This is one of the things I talk about test taking strategy. If I'm taking the test and I see that idea, I say, oh, go to the pathophysiology. Asthma patient is bronchospasm, constriction caused the problem. Any medication that is should be avoided in asthma patient, trust me, even if you don't know what it is, it causes bronchospasm. Therefore, adenosine worsen asthma bronchospasm. That is the strategy. Every time they give you a medication and they say it's contraindicated, look at the pathophysiology for the problem. Asthma problem, bronchospasm. Adenosine, if it's contraindicated in asthma patient, is probably causing bronchospasm. The right answer is it worsens bronchospasm. So that was somebody asked. I'm just answering a question. This is what rhythm it is. This is bradycardia. It's so slow. You can have, if I make it bigger, 1, 2, 3, 4, 5. So it's like 60. So it's like 50 something. Like there's one close to 6. So bradycardia. Bradycardia. Which of these medication can cause bradycardia? This is a ACE inhibitor. It does not cause bradycardia. This is dopamine. It speeds your heart up. So this is your right answer. So that's your right answer. Okay. And then provide care for a client with this rhythm. Client has no pulse. Which action the nurse should take? I have no pulse. But this is what I have. I have no pulse. But this is what I have. I have no pulse. But this is what I have. What do you think? What do you call it? You see this rhythm, but there's no pulse. I see this rhythm, no pulse. I see this rhythm, no pulse. Means pulseless. That this is what? Is an electrical activity. Therefore, pulseless electrical activity. That's what you call it. So pulseless electrical activity. This is PEA. Now you got it. So if it's a PEA, it means your heart is dead. Like your heart is playing games with you. If it's a PEA, what would you do? Check the client pulse, immediate synchronized cardioversion, immediate high quality CPR, immediate defibrillation. What do you think? I intentionally said these questions. I mean, I said them this morning. If they're a little bit cumbersome, I apologize, but it's Adapt NCLEX way to let you teach, show you. You shouldn't just memorize EKG. You should be able to like, because I bet you, when you go take a test, they will give you a scenario and they will give you this, and you put it together and you figure it out. But stick with the concept. Don't bother them. Don't care what they tell you. Stick with the concept. And the concept, who know what the concept of PE? What is number one concept? Tell me. The main concept of PE is the same thing as asystole. I said it already. What is the concept? You don't shock. Excellent. It's not a shockable rhythm. It's not a shockable rhythm. So as asystole is not shockable. Therefore, you go back to the answer choice. You see, you already eliminated what? A bunch of them already, right? B and D is gone right there. So you have 50-50 chance. If you do that, you're doing good. Now you have 50 to two choice. Your chance of getting it right is better than not going with that concept. Tell yourself before you pick an answer, the concept is no shock. I don't care if it's a defibrillate or those answers are difficult to run away from. You say, oh, synchronized cardioversion, it's a good thing. Immediate defibrillation is a good thing, but the concept is never apply electricity. Therefore, 3B and D is gone right there. And then you left with two. Then you go back to the question. This is the purpose of this class. I know I try to do it for you guys, but this is the purpose. What is the buzzword in the question? Tell me the buzzword in the question. No pause. Excellent. Client has no pause. Therefore, why do you want to pick A? Check the pause. I've told you client has no pause. If you pick A, you're not paying attention to the question being asked. You're just being distracted. I said the client has no pause. I've already done assessment and you see the rhythm. He has no pause. He's not going to have pause whether you check it or not. He has no pause. Therefore, you see two things I used to get the right answer right. You have no pause and there should be no shock. Therefore, this and this is eliminated. You don't even have to think. Now you already eliminated the answer three without even going for the right answer. Whatever is left is your answer choice. So high quality CPR is the best answer. But the question itself, answer itself. So that is why I say pay attention to the question and never answer a question without not figuring out what is being asked of you. And then you figure it out. I told you the nurse finds this and patient has no pulse. You identify it as pulseless electrical activity. You know there should be no electricity. Therefore, this and this is gone. If he has no pulse, then I don't need to check for pulse anymore. And I'll pick C as my right answer. Okay. Let's provide care for clients with this rhythm on the cardiac monitor. What is the next first action? What do you see? What do you see? Once again, check if it's sinus or the rhythm is regular. You see, there's only 2.5 boxes. This is the same. This is the same. Therefore, this I know it's not AFib. I know this is some rhythm that is regular. I try to calculate the rate. It's almost like 100, like 110. This 2.5. So over 300, probably like 110 or something like that. So the heart rate is 110. And then I see T wave and P wave. Look at this. I want you to pay attention to this carefully. This, you see how they're close to each other, but you can see T and you can see P. All of them. You can see P and T. It's not that the P and T are together. If the P and T are together, it's SVT. But if you can see a distinct, but they're close to each other, it cannot be SVT, right? So this is sinus tachycardia. So this is sinus tachycardia. Now that you know, what do you want to do? You don't do CPR for sinus tachycardia, right? You know, right? You don't do immediate cardioversion for sinus tachycardia. I know you know that. And you should not do that because it's a sinus tachycardia. When you see somebody with sinus tachycardia, what do you do? What should you do? Look for possible causes. Excellent. Somebody said that. Possible causes. So the possible causes may be anxiety. It may have infection causing fever, hypovolemia, or it may have some pain. If you can't find it, then before you treat it. But most of the time, don't do anything until you figure out what is the potential causes causing the problem. Therefore, that is the concept. You see what you're doing? When you do that, when you're answering the question, you know what you're looking for, guys. I'm not the best out there. I'm just adapting class. I just want to know there's no magic for your test. The best way is to figure out how to approach the test and don't just answer questions. You know, just come up with something you can hold on to, and then you use it to look at the answer choice. You tell yourself, as sinus tachycardia, I need to worry about the concept. The concept is what? Possible causes. And I know possible causes. And you hold on to that. You're not going to pick an answer choice that is not the possible causes. CPR is not a possible cause, right? Synchronized cardioversion, you doing something, right? Administer metropolo, I don't know the possible cause. Therefore, I got to do C. Okay, that's what I would say. I have to assess you. Somebody say caffeine. Yeah, caffeine can cause that. So this is sinus tachycardia. This is a response to underlying condition, right? The next should assess temperature, fluid status, pain level, anxiety, and sometimes shock. The underlying condition need to be investigated and treat accordingly. That is my rationale for answering this kind of question. Okay. And next is assessing a client in the emergency department. After connecting the client to the cardiac monitor, the nurse should recognize the rhythm on the monitor as what? So what do you see? But this is the way I want you to approach it. See if the rhythm is regular. And you can see, draw a line or eyeball it. You can see this look like it's regular. And then try to calculate the rate. The rates look like it's just like one, almost like 300 or 250. Like it's too high. And then you look, you can't find T and P. I told you already, T and P together. If you can see T and P close to each other, this is sinus stack. If you can see the difference, this is SVT. If you can find a bunch of them, this is Flutter wave. If you can't see the atrial at all, this is atrial, AFib. That's all. Between all these guys, you'll be able to identify EKG easily. So somebody already said it. Supraventricular tachycardia. So that's the right answer. It's no sinus tach. It's no ventricular rhythm. Why? Because I can see the ventricle look normal. The only thing is the T and this one that look abnormal. So it's not a ventricular rhythm. This is one of the strategy too. Why would you pick V-Fib and V-tach while you can see a uniform ventricle? Why you would do that? You shouldn't do that because you see a uniform ventricle. This is a ventricle. It look normal. It cannot be a ventricular rhythm. The between this is between P and T. The ventricle once again look normal. And next, observe this rhythm strip on the client monitor during initial assessment. What should the nurse do? So during initial assessment, this is what the nurse saw. What do you see now? Any atrial rhythm. Do you see it there? There's no atrial, you don't even see P wave. So these are all ventricular problem. It's a ventricular problem and it's uniform, a uniform ventricle. So therefore, this is a V-tach. That's all. You see, this is very, very uniform. By the ventricular rhythm, you go back. This is V-Fib. This is V-Fib. But this one is different. It's uniform. They all look the same. So this is a VTAC. If this is a VTAC, what do you want to do? And then observe this rhythm straight on the client monitor during initial assessment. What should the nurse do first? After you see this, it's a ventricular tachycardia. What would you do? High quality CPR, immediate defibrillation, immediately feel for pulsation in the carotid artery, immediately notify the EKG provider. So this is a VTAC. The first thing you do after VTAC is to check the pulse. But you see, check the pulse there? Yes, check the pulse. Watch for these kind of answer choices. Everybody is expecting check for pulse, check for pulse. But I just rewrote it and say immediately feel for pulsation in the carotid artery. It's the same thing, check the pulse. Your board may do that to you. You'll rewrite the answer choice using just the language to confuse you. So watch out for that trap. So it's the same thing. I'm checking the pulse. The rhythm is ventricular tachycardia. The next step is to feel for carotid pulse. And the last one. And let's provide care for a client with pneumonia. During assessment, the nurse recognizes the rhythm on the cardiac monitor. So patient has pneumonia, and you find this. What is that? The rate is probably 1 to 3, so close to like 100. And then you can see the T and P are together. T, P, and together. You only see 2. You don't see 3 waves there. So it cannot be Flutter wave. You don't see ventricular, the ventricle look uniform. It shouldn't be ventricular problem, right? It's not too fast. If you see this, it's supraventricular tachycardia. And then you're done. It's too fast to be bradycardia. So bradycardia is eliminated, right? It can be ventricle. The ventricle look fine. And then supraventricular tachycardia, it cannot be. So this is your right answer. Guys, this is Adapt NCLEX. Thank you for watching. If you've not subscribed, you can see the link there, Adapt NCLEX, and you can subscribe. But take care of yourself, and then all the best of luck. Remember, you should keep charging. Never stop charging. And then best of luck for you. Bye.